Hey guys, Dr. Miriam, family nurse practitioner here. I posted a video a couple weeks ago that was talking about the 5 MTHFR gene mutation. What happens, what potentials can occur if you take folic acid and the buildup of unmethylated folic acid, or UMFA, that can happen because of it, and how that could be affecting your baby's brain. And that video went viral, and there were so many questions, and that sent me into this deep rabbit hole where I started to learn things that I was never taught in school. I am a family medicine nurse practitioner. I have a doctorate, Doctor of Nursing practice, and I have worked as a nurse in oncology, in fertility, in obstetrics. And these are things that I was never told, no matter what area I worked in. And now I work with kiddos that experience autism. I have my own practice looking at the whole body and root cause. I will be the first to admit that I was that provider that was saying, hey, use high dose folic acid, because other providers I work with had said, yeah, tell the patients to do this, use high dose folic acid. And the rabbit hole starts with people that have the gene mutation. And I was like, and if you don't know if you have the gene mutation, well, let's just assume you do until you know. And then I started to realize it's actually all of us that need to be aware of. So here's a couple do's and don'ts. Keep in mind, this isn't meant to scare you. This is meant to bring awareness. People will message me and say, oh my gosh, I'm not taking this type of vitamin or that type of vitamin. Now I'm scared. It's not to scare you. This is not fear mongering. This is information that you might not have known before, that now you know, and now you can ask more questions. Now you can potentially do something about it. So some basic do's and don'ts. So basic things are, with any preconception, is do take your vitamins. Make sure they are methylated forms of B12, methylated forms of B9, methylated or broken down forms of B6, the P5P versus the pyridoxine hydrochloride. You can look at the label, you can get my guide, links in my bio, and it'll explain all of what I'm talking about. So get a really good multivitamin, because neural tube defect happened before most women even know they're pregnant. The neural canal, it closes at 28 days. Most of you don't know you're pregnant before then. And so do take a good vitamin. If you even are trying to get pregnant or you're having unprotected sex, just take a really good vitamin that has methylated 5-MTHF, 5-methyltetrahydrofolate. That is the most active form of folate. My guide has specific ones I prefer. Look at your diet. I mean, it's what everybody says. Get movement, get some sort of resistance training or exercise. Look at your diet, minimize sugar intake if you can, because as a fertility nurse, I often saw a lot of women with PCOS, which is at its core an insulin resistance issue. Insulin comes from too much sugar. Insulin resistance comes from having too much sugar. So look at your diet, look at your movement, look at the supplements. And it's not just for mom, it's for dad too, because the sperm matters just as much as the egg when the embryo is created. Look at your diet around how much folic acid or fortified food are you taking in? How much fortified food is your partner or dad taking in? That matters. The quality of your food matters. What you put in your mouth matters. Other than that, essentially, it's what everybody says to live a healthy lifestyle, but your vitamins matter for you, they matter for dad, and just look at the whole picture. Look at your own stress levels. As a fertility nurse, we had plenty of patients that came in and they were so stressed by the process of trying to get pregnant that, let me give you an example. If you are in fight or flight mode and your body thinks you're being chased by a tiger, do you think it's gonna stop and wanna get pregnant? Absolutely not. So look at your stress level, pay attention to your own cortisol, your own stress that your body is under. If you're having trouble getting pregnant, that's the first place I look. Nutrients and stress. All right, so here's a couple don'ts. First off, on the idea of do reduce your stress, is don't buy into like the fear mongering around, that everything's gotta be perfect in pregnancy and everything's like, there's so many things you can do wrong. Like, we are very resilient beings, and we have a lot of leeway, and we have a lot of, our body adjusts greatly. But do follow the do so you don't have so many don'ts. Don't avoid looking at your partner if it's not just about you and being pregnant. Like, look at your partner, look at their own diet, their own exercise, their own stress levels, because the sperm plays a role in the DNA of the embryo that turns into the baby. Don't make huge changes in your diet in the months prior. especially like there's a lot of women that want to try and lose weight before they get pregnant because they're like, oh, I don't want to have all this baby weight. Just wait till afterwards. Like if you want to lose weight, just wait till afterwards. And here's a deeper reason why. This isn't just like frou for fun, but there are a lot of toxins like organophosphates, which come from pesticide residue or pesticides if you're not eating like organic foods, that they store in your fat. Heavy metals also can store in your fat. When you lose weight, those are gonna get mobilized, meaning they're gonna open, like when you're losing fat cells, when you're getting rid of them, yay, but now you're mobilizing toxins into your system. If you actually haven't worked on making sure your system can clear those well, if you're not using supplements to help clear those well, then you have the potential of passing that on in utero. Do not do a detox protocol within 3 to 4 months of trying to conceive. If you are going to follow a do and try and improve your own body's toxins and improve your own body, do not do it within 3 to 4 months of trying to conceive, for the same very reason that your body is still going to be mobilizing and releasing toxins in that period once you've gone. So if you do, let's say a 6 month detox program, your body's clearing toxins. When you stop, it's still going through the process of clearing toxins. That is not a time when you want to get pregnant because you will transfer that on. Allow your body to clear itself before you go do that. Do not over supplement. People say like more is better. I'll just take more of this and more of this. Well, if you look at my video on folic acid, and if you listen to what I'm saying about too much folic acid, then you will understand that too much of a good thing isn't always better. It doesn't mean better outcomes. And in this case, it can mean worse outcomes. So don't take more than you're supposed to. Don't take more than is recommended. So when it comes to pregnancy, when it comes to trying to conceive, women, it's very easy for us to get in our heads. It's very easy for us to get very stressed out. It's very easy for us to get like really worked up about what it means to get pregnant or not. In the process, consider my do's, consider my don'ts, and know that we've been conceiving for hundreds of thousands of years. Like our body knows what it's doing. Trust the innate knowing of your body. Listen to the innate knowing of your body. If you don't know how, find somebody to guide you back to it, because your body knows really, really well. If you find yourself in a place where you have tried different avenues, you've tried different providers, you've tried so many different things and you're not getting anywhere, then reach out. Ask me questions. Let me know what's happening. It's really important also to consider the whole picture, to consider your whole body. I have recommended acupuncture for people and they've gotten pregnant shortly after. Like there's a lot of other things, conventional medicine. When you put conventional medicine and naturopath or functional medicine together, they work more synergistically. And then when you put, a bigger spiritual lens all together, then you get that much more information. So if you find yourself at a crossroads, reach out, ask questions, go to my website, find a way to get in touch with me, because I would love to work with anybody that finds themselves in a system that they feel stuck and desires some guidance.